Hey, it's Dr. Thornell with New England Family Chiropractic, and I want to give you a quick little reminder today about the importance of consistency with your chiropractic care and why it's so important. In my hand, I have a typical rubber band, and I'm going to place that rubber band around my pinky while we have this conversation. I'm going to wrap it around there 5 or 6 times so that it's good and tight. And I'm going to leave it there while we talk. And most of you would be saying, well, gee, that's probably not a great idea because that's going to stop blood carrying oxygen and nutrients into that finger. And at the same time, it's going to stop the waste products of metabolism that happen in living cells from getting out of that finger. That's what happens when blood supply comes and goes from living tissue. Now, within a matter of minutes, as you'll see, my finger's going to start to change color and eventually it doesn't feel very good. But the reason I go through explaining it this way is that in your spine, when the joints are freely movable, that's how blood supply gets in and out of those joints. I often use the analogy of a sponge in a sink full of water, that if the sponge is sitting in the bottom of that sink and I push on the sponge, I'm going to squeeze all the fluid out of the sponge. And when I let go of it, it's going to suck fluid back into that sponge. And the fluid that goes in is different than the fluid that went out. So there's a transfer of fluid in and out of the sponge. Well, within your spine, as you bend and twist and walk, there's movement. And that's what allows for fluid transfer in and out of your spine. That's the only way it happens. There's no arteries that come down and supply the discs. There's ambient fluid in and around the spine. And through movement, we pull fluid in, we push fluid out. And that's what keeps those joints healthy. What happens when those joints become restricted in movement is we don't get as much of that fluid transfer, or if the joints are really stuck, we don't get any of that fluid transfer and the joints start to die. Now in my finger, right now the predominant color is white. I don't know how well you can see that. But eventually it's going to start to turn all sorts of colors, and we all know if I leave it that way, eventually it's going to turn black because it's going to die and my finger will fall off. At some point in this process, I'm going to start to have pain as those cells begin to suffer from oxygen depletion and they die. Similar to a heart attack. That's what a heart attack is when we have a blockage and we're not getting enough oxygen to the muscle cells. Well, that pain is a symptom of a problem that started long ago. And for spinal issues, that pain takes a long time. It's pretty rare that the joints are stuck completely. They're just losing that motion that allows for normal transfer, so the process is slow. So it might be days, weeks, months down the road before we develop symptoms in and around the spine. So the lesson is we want to keep well adjusted to prevent any blockage of nutrient flow in and out of those joints, as well as allowing the spine to do its job, which is to protect the nervous system. The other part that goes into the spine that doesn't happen in the finger is when we have normal joint motion, we look at the anatomy of those joints. We have bone, disc, bone. Within a matter of days, 3 days, we start to develop scar tissue, keeping those joints immobile. You can see how different that second picture looks than the first one. All of that extra white stuff that you see there is scar tissue that's joining those bones together, further decreasing its ability to move properly. So very importantly, we want to, I don't know how well you can see, that's not looking great. We don't want to keep it that way much longer here. It's very important to, on a regular basis, make sure that those joints are moving freely, not so much for you today and the complaints or symptoms that you have today, but it's for the you 10 and 20 years down the road that doesn't want to have an arthritic spine. Because as my finger turns black, now red, as you can see the blood rushing back into it, as my finger turns black and dies, the same thing happens in the spine, but we call it arthritis. when joints don't get normal tissue, when tissues don't get normal blood supply, they will eventually die. In the spine, we call that arthritis, and eventually that starts to cause us symptoms and pain and all sorts of things. And we say, oh yeah, I just have a bad back. No, you neglected your back for way too long a period of time, and you allowed that to happen. So just want to remind you, we don't see you regularly enough, and that's the process that's going on inside if we're not getting regularly adjusted.